3.
I'm Kyle Smith. This is Katrina Cardwell, Flexion Distraction Lab. I'm doing tolerance testing. First thing I'm going to have my patient do is approach the table so that I can see if the table is just above the knee. So what I'm going to have you do is lean up onto the table with that knee, plank up, crawl up as far as you can. Okay. So now lock this back up, make sure ASIs are good. Slide it down just a little bit from it. There you go. That's good, just like that. So now unlock the table. I'm doing tolerance testing. The first part of tolerance testing is central distraction testing. This utilizes the tiller bar and the segment of diagnosis. For this point, we're going to use the L4, L5 segment. So what I would do is I would take a inferior traction and lock on to that segment. All of this needs to be done skin on skin, so I need to give my patients permission to expose this area. So is that okay?
Yeah.
Okay, so what I would do is just expose the area of interest right here. So again, I'm coming inferior, locking in superiorly, and I am going to go down 1.5 to 2 inches, or to I see that occipital lift. So going right there, see the occiput come back. Does this cause you any pain?
No.
Patient said that no pain was observed during this tolerance testing. However, if pain would have been experienced, what I would do is have that patient come in for 1 to 2 days, and I would do some sort of passive modality such as cryotherapy or interferential, something to target the pain. That way we can get those receptors down and focus on that pain. Next, what I would do if that patient passed central distraction testing, I'd move on to lateral distraction testing. This is done without the tiller bar. It utilizes the patient's good and bad leg. Same concept though, skin on skin. Find L4, L5, start superior to it, work inferior, and then lock in back superiorly. What I'm going to do is I'm going to take the good leg first, again 1.5 to 2 inches down, or till I see that occiput lift. So, right there. Good leg, bad leg. Did you experience any pain with that?
No.
No pain was experienced with that. However, if my patient would have experienced pain, I would backtrack. I would go, again, lock into this L4, L5 joint, and I would use the tiller bar for my therapy. My therapy would be 1 to 2 days. It would be 3 sets, 5 reps, and each rep will be held for 4 seconds. Once that has been completed, I would then go back to, during that therapy session, in between each set, I would do trigger point goading just to make sure that all the trigger points are taken care of. Once the patient progresses and is now ready for tolerance testing again, we backtrack, we go back to make sure that they can experience the tiller bar, it's fine. We go make sure they can experience lateral distraction, it's fine. And then once that's done, we do lateral distraction with cuffs. So at this point, we got plantar flexion in the foot. We lift up, here, down. Lift up, down. Short pacings are easy because it already comes with plantar flexion installed. Now we're going to do the same concept as tolerance testing 2, except with cuffs. So again, skin on skin, find L4, L5 segment, start superior to it, work inferior, lock into that joint. Good leg, 1 to 2 inches down or till occipital lift, right there. bad leg, right there. I'm again ask my patient, was there any pain experience with that?
No.
Okay? And each of these things are held for 4 seconds. I'm asking my patient, is there any pain with that as this is held for 4 seconds? So the patient experiences no pain, so what I'm going to do is complete tolerance testing. However, if pain was experienced, I would backtrack. I would take off the cuffs. The leg up for me, please. Leg up for me, please. And I would do therapy session with lateral testing with no cuffs. So I would lock into that joint, 1 to 2 days, 3 sets, 5 reps, and 4 seconds hold per rep. In between each set, I would do, is going to be a minute, so during that minute, I'm going to do trigger point testing, and I don't know if I made this clear already, but 1 rep or 1 set is 5 reps, and 1 rep is good leg, bad leg, 1. Good leg, bad leg, 2. So, pretty sure that completes tolerance testing. I'm Kyle Smith. Thank you. And now that tolerance testing is complete, I'm going to have to get my patient off the table. So to get her off the table, I will lock. I will bring down just a little bit so I can get it to where I can see. Unlock it. Extract down. Lock up. Completely drop it. Ask my patient to slide off in that same plank position, putting your good leg down first.
Oh, I feel so much better.
Tolerance testing and its fullest.